Well, no matter your age, adjusting to change or dealing with life's stressors can be really challenging. Whether it is starting a new career or dealing with a major loss, many people find it difficult to adapt to these changes. This type of distress, in extreme cases, can actually lead to what experts call adjustment disorder. Joining me now is Jennifer Hartstein. She is a family and clinical psychologist. Hey, Dr. Jen, great to see you. First, help us understand more about what exactly adjustment disorder is, and are there different types of this disorder based on different circumstances that someone might be going through?
Yeah, so adjustment disorder is a diagnosable disorder that often can look like anxiety or depression, but it really is something that develops in response to some sort of stress. So it's kind of a reaction that seems bigger than might be needed for whatever the situation is. It impacts our thoughts, how we feel, how we act, and it's really related to so many different problem areas we have in our life, and that's things we need to kind of keep in mind. And there is more than one kind of adjustment disorder, as you noted. So we can have adjustment disorder with depression, we can have adjustment disorder with anxiety, we can have adjustment disorder with both depression and anxiety. Sometimes there's, especially in young people, disturbances in their conduct. And sometimes we don't really know, it doesn't fit into a specific box. So we call it unspecified because it kind of branches over all the different areas. And so we want to label it so we can treat it, but we don't have a specific way to put it in a box.
You know, Dr. Jen, walk us through the common symptoms. What does it look like in children versus teens or adults?
So common symptoms are really across the board very similar, where we might be feeling sad or hopeless, especially in an adjustment disorder with depression. Maybe we're crying more, we might be more restless, we might be more anxious, maybe we're not sleeping so great, maybe we're eating too much, we're eating too little, we're isolating, we're irritable, and kind of that goes across all ages. So if you just notice a change and maybe you just moved, those two things might go together, and we might want to really kind of start to talk to the people in our lives about how they're doing and what's going on.
It's good to see those on the screen there. And some of the common causes and risk factors, what triggers this kind of adjustment disorder at various stages in your life? Maybe, and can it come on later? Like maybe you were okay with change when you were younger, but then as an adult, you get more kind of stuck in your ways.
100%. As we get more rigid in our routines and our structure, something that throws us off can be hard. And the fact is, change doesn't stop just because we do get older, right? So maybe your job changes, or you lose your job, or you have to move. Those are major life stressors that impact all of us at any age. And just because we're older doesn't mean we always have the right coping strategies. And so there are risk factors we need to keep in mind, like what happened to us when we're children: bullying, difficulties in school. Are we having problems in our relationships? Are there any major life changes? One of the biggest life changes is moving, and one of that causes the most stress for many of us. Are we having problems at work? Do we have a chronic illness physically? Is that making things hard for us? All of those pieces together can make that adjustment harder. And then we kind of, for 3 to 6 months, might have a harder time being in our regular routines. So we might need extra support during that time.
Dr. Jen, when should you seek treatment? What does that help look like? You know, if you give yourself a little bit of time to settle, but it's not really going away and you feel like it's developing into something serious, you know, where do you go? What are the options?
So I think the first line of defense, if you're feeling more depressed, more anxious, your behavior is not the norm for you, we want to go seek therapy and find a talk therapist that can help us. We know that works. We know medication can help for short periods of time. But if those things aren't where you need to go, what kind of self-care and true self-care, journaling, meditation, getting outside in nature, what kind of coping skills can you lean into? Where's the support in your life? Maybe it's at church, maybe it's in family, any of those kinds of things. And I think we cannot minimize the importance of laughter and fun to make things better for us.
Jen Hartstein, as always, we appreciate all of your advice. Thank you so much. Have a great new year. And folks, stay with us. You are watching